Hello, everyone, and welcome to another audio podcast under this series, the LabZtorm Impact v.2. This is the Shientist, and it's another Storm Robotics production. And today I'm going to be talking a little bit about what is referred to and known around the perspective on patient and public involvement, or PPI, and the preliminary commodity in healthcare. In order to do this, I'm going to give an overview in this audio podcast in relating to invited works where there was a sort of a collaborative effort between the Renal Patient Support Group, the RPSG, and in academia, and a particular academic institution in the United Kingdom known as University of Brighton. And basically, in 2014, there was an effort where a colleague in academia at University of Brighton at the time wanted to get involved in trying to understand the remit around the remit around the Renal Patient Support Group on the RPSG in relating to how the social media platform could be used to prompt sort of online discussions and forums about different aspects surrounding a particular healthcare condition. Now I'm going to give this over, and I'm going to give this overview in relating to, at that time, around 2014, and in line around 2014 in relating to this, where this colleague and collaborator at the time at this academic institution was looking at something relating to enacting online support, a patient-led project to understand peer support, coping, campaigning, and research in online forums. And all of this, ironically, in 2014, it was the National Institute of Health Research that actually developed a framework around patient and public involvement, and there was a framework and a document that actually was published in relating to patient and public involvement, but also in relating to social media platforms in context of research. So in this particular research led by a colleague at Brighton University at the time, again this was in 2014, the purpose of the project of this project was to explore how and to what extent patient-led social media forums or platforms act as a resource for patients, healthcare professionals, and informal carers. And focusing specifically on the renal patient and carer community, the project looked to examine activities was prompted to look at encourage and prompted to examine activities taking place in four different across four different social media platforms. So at this time, the Renal Patient Support Group, or the RPSG, wasn't the only social media platform, or at least online platform that the colleague and collaborator looking to collaborate with and get understanding and perspectives around. So this project had been initiated by patients who healthcare patients who were involved as were prompted to be involved as co-researchers alongside academic participants. And there's a few terminologies I'm going to highlight that get thrown about in the world of patient and public involvement. And basically, there's sort of renowned authors around patient and public involvement research in the United Kingdom and in other parts of the world. However, everyone uses different terminologies. Now, a few of them I'm going to mention, but generally all are under patient and public involvement. So there's something called action research. There's something called participatory research. There's patient and public involvement, and there's also patient-centered research, alongside a few others. In this research, or in this work, there was an effort where an action research approach would be taken, in which patients and academics will share knowledge and experiences as co-researchers. Now, when I say co-researchers, is important because in academia, unlike in actual areas of healthcare, generally in academia, what happens is if there's a patient and public involvement, then generally speaking, those who are of the intrigue that academics and researchers are look to collaborate, then generally they are known as co-researchers, versus those in healthcare. So where patient and public involvement is specific in healthcare professionals who lead research in academia and involve patient organizations or etc., do not view them the same. They are not seen or viewed as co-researchers. And in this context, it is why healthcare is actually very one-sided. It has been for a long time. Now, there were two stages to this particular project and the design around this project that my colleague at Brighton University at the time in 2014 had looked to gain some grounding. So the first was to undertake an analysis of data from 4 online social media forums or platforms, and from interviews conducted out with participants and organizers acting within the social media platforms or the forums themselves. And the second stage and part of the work was to entail on carrying out a piece of what would be known as patient-led research through these 4 individual forums, online platforms, in which patients collectively decide upon and interact in a particular research project. And the aim in this stage, the aim or the objective in part of this work was to explore questions of ethics and methodology relevant to online patient-led research, and to put findings forward in question by conducting or carrying out research project through online platforms. The research objectives around this work were thus: number one was to explore how and to what extent social media is used as a platform for support, research, and something that is known as campaigning. Number two, to understand the extent to which such platforms support and inform patient and carer sort of inform patient and carer lived experiences, and in lived experiences specific to coping strategies. Number three was to examine how and to what extent patient-led social media or platforms can inform and enhance clinical education. Now, part of this was to, or at least the first stage of the research was to collectively conduct a detailed textual analysis of excerpts from four relevant online forums or platforms. And in the early stages of the analysis, there would be a focus on understanding the four areas of activity, which are: number one, support; number two, coping; number three, research; number four, campaigning. In addition, research interviews would be carried out or conducted with routine contributors and organizers of these different online or social media forums or platforms, in order to understand what is required to enable them to produce a space in which patients and carers can support one another. Initial themes and findings would be shared with the online group and discussed with a selection of patients in research interviews. And feedback from the comments from online forums or social media platforms and interviews would be incorporated into the analyses. So initial findings would then be shared with healthcare professionals and clinical educators in a series of action learning sets. From these action learning sets, the potential value of online social media platforms or forums to clinical education would be articulated, explored, and reflected on. So this was part one, or stage. It was part one of research or patient and public involvement based focused research, retrospectively from 2014. That was part one. Part two of this was where the objectives were to explore the ethical and methodological implications of online patient-led research activity. Number two would be to undertake online patient-led research using a participatory action research approach. Number three, to develop strategies to supporting and empowering patients as researchers who can contribute to health service advances. I'm now going to talk a little bit about some a little bit around the plans around this. Having developed an understanding of how online platforms or social media platforms produce a space where patients and carers can enact support, at the time in 2014, the discussions and collaborations was to explore questions that arise when patients wish to initiate research activities with peers through online or social media forums or platforms. In order to do this, my colleagues and I would look to explore and understand the methodologies open that would be open to both in academia, both in related to academia and in relating to in relating to particular methodologies, and then furthermore understand the ethical implications of those particular methodologies. Having investigated and explored and documented different approaches available, the idea would have then been to carry out some patient-led research through the online or social media forum or platform. A little bit about the research plan. So at the time when this was being developed, the first part of the research would have taken around 12 months to complete. The ethical approval would be sought, and where permitted, data extracts would be taken from the online or social media platforms. These will then be submitted. These would then be analyzed using thematic analysis, which is a broad thematic analysis broadly organized around four main themes. Again, support, coping, campaigning, and research. This preliminary thematic thematic analysis was based upon the literature pertaining to patient communities and upon the feedback and the comments and experience of patients, co-researchers involved with the project, with the research. Analysis involved with in the planning around this research. Analysis would not be limited to these themes, but would be inductively developed to allow other thematic framings to develop. Analysis will then be taken to patient carer, healthcare professional, and academic co-researchers. Themes would be attributed to stakeholder groups where applicable, and findings from the analysis would be shared with online patient platforms or social media platforms and communities where between investigators we would look there would be a prompt to encourage patient communities for their comments. Stage 2 would have taken would be undertaken in between 13 to 24 months and undertaken as participatory action research. The precise research strategy would therefore develop as the research had progressed. The research team will have explored potential methodologies and ethical implications of patient-led online research, and there would have been a co-design. There would have been then to co-design a research where the online platforms or social media platforms are employed as a means of designing the research question and collecting data. Data analysis would then be conducted out using an appropriate methodology. Appropriate research training would have been provided for patient researchers within as part of the part of the research team. Where patient researchers wish to interact in formal academic research training, this would have been provided. Where investigators would prefer bespoke informal training, this would have been offered as well. Now the outcomes, and these were outcomes that didn't happen. They didn't happen in 2014. They didn't develop, but these were outcomes that would have come out of this particular research. The outcomes of the research would have been to improve understanding of how and to what extent online or social media platforms act as a resource for patients and carers. Number two, understanding of how research could potentially, how participants could potentially act as a resource for clinical and patient education programs. Number three, exploration and detailed documentation of methodological and ethical consideration associated with patient-led online research. And the final one of the final outcomes of this was where outputs from research on patient-led research. One of the main outputs would have been to have patient-led online research conducted as part of this main project. Now, this work was developed or co-developed even again with collaborators at the University of Brighton in 2014. It's now 2022. This research did not unfortunately take place with or in collaboration with the University of Brighton. Unfortunately, my colleague and collaborator developed this sort of outline in 2014, and in that time I was involved, and one of the other colleagues and collaborators at the time who attended this meeting at Brighton, at University of Brighton in 2014. At the time, I was involved in supervising one of my other colleagues, another colleague, and their research that linked to research that was being developed or coming out of that was developing in line with kidney care practices from an initiative that this colleague came out with, which was known as sort of where they were developing a sort of an awareness around renal replacement therapy or renal replacement therapy and they had an initiative an initiative that developed, which was prompting patients and carers to wear wristbands to say, for example, that in a particular on the non-dominant arm, for example, where they would wear wristbands, the colleague was developing research at the time, an awareness where on the wristband to prompt medics and clinical experts not to cannulate, not to take blood from a part from that arm or non-dominant arm, for example, because it is where they have their renal replacement access. So this colleague was developing this research around an awareness, a wrist awareness wrist awareness band project around renal replacement therapy, and I was involved in sort of supervising aspects of that research, which was in collaboration in part with another colleague at London South Bank University around the same time. Now, this work at Brighton University, University of Brighton, unfortunately, as mentioned, it didn't go forward. There were lots of discussions that came out of meetings, and unfortunately, following this research outline from 2014, none of this work actually developed any further from the University of Brighton either. There was discussion around that time where investigators would seek to source funding to develop aspects of the research. However, in relating to patient and public involvement, the preliminary commodity in healthcare, again, is the knowledge base that either health professionals provide, where patients provide, where the carers provide, but it becomes almost meaningless when that involvement or discussions that take place that took place in that era around 2014 didn't go forward. And so I thought I'd provide this audio podcast very briefly because these are two sort of project or research project outlines that still have not been developed. In part, the answers the works around the projects, the two research sort of outlines. This more prospectively and around now, around 2020, around 2022, have been developed, but from different perspectives. And what I'm saying is that in academia, in academia. Now, this research outline doesn't have any sort of references or citations, unfortunately. So at the same time, the research outline um, were points where there was no actual sort of evidence that my colleague or collaborator at the time actually looked and delved into. There was again constructive discussions around the two outlines, but unfortunately it became more the research outline became were sort of outlines to sort of research projects that could have been. And again, the main commodity in healthcare is the knowledge base that healthcare professionals, researchers, patients, carers, etc., sort of prompt in areas of where there are gaps in areas of service provision, healthcare service provision, for example. And so my colleague and collaborator knew at that time, and again, the renal patient support group, or the RPSG, at the time was maybe 4 or 5 years old, and knew that there was a wealth of shared lived experiences through the RPSG, on the RPSG at that time. Again, we're now in 2022. The RPSG now has close to 10,000 members globally. And so basic in line with this, we now know that the RPSG, the renal patient support group, the RPSG, has members providing understanding, etc., through the social media platform or online forum. And there are health professionals and researchers, etc., whilst may not proactively be contributing to discussions, etc., or even helping to answer particularly important questions that patients or carers may have. We know that between 2014 to 2022, and if not before, we know that generally health professionals and researchers are using the RPSG to learn from patients and carers, etc. However, the damnedest thing is that they are not contributing, which also leads to the point around this research question of the research outlines where actually researchers and health professionals in relating to healthcare are still very one-sided. I mentioned the preliminary commodity in healthcare are researchers, are patients, are carers, but any of those commodities are generally no good if they are not able to link aspects of where they're not able to link aspects of uh, of of um, of real issues across across different areas of across different areas of different disciplines and practices. And this is an ongoing it's an ongoing syndrome, because basically patients still suffer at the end as well. Medics, dare I say it, they are not very good clinical educators at all. Researchers, at least in healthcare, are actually also not very good educators, because what it is, where research is concerned, they use, and dare I say it, abuse aspects of involvement, so thus they move up the career ladder, so to speak. And so when this research was done, and by the by, peer support research has been published that's inclusive around the renal patient support group. Coping research has been conducted and has been inclusive around the renal patient support group. Campaigning, although I don't like to call it campaigning, but generally initiative-based research has taken place and been published through the RPSG, the Renal Patient Support Group. And as a social media platform or online platform, as far as evidence-based research goes, and in and across those different different terminologies that surround patient and public involvement, no academic, no researcher, no health professional has done that much research that is not just inclusive, but also all-encompassing. I want to say thank you for listening to this audio podcast. This has been an audio podcast on the series around the LabZtorm Impact v.2. It's a Storm Lobostics production. I've been your host, the Shientist, and this has been an audio podcast in collaboration with the Renal Patient Support Group, the RPSG, on perspective on patient and public involvement, the preliminary commodity in healthcare. Thank you for taking the time to listen.